Your child's oral health. Things a parent should know. Question number 1. When should your child first see a pediatric dentist? Both the American Academy of Pediatrics and the American Academy of Pediatric Dentistry recommend that a child be seen by a pediatric dentist by their first birthday. This is to evaluate proper oral and dental development and to review good oral care at home, including the effects of nursing and bottle feeding on a baby's teeth. Baby bottle tooth decay occurs when an infant or a child falls asleep while nursing or suckling on a baby bottle or sippy cup with juice or milk. That last suckle does not get swallowed, and so it sits between the lips and the teeth for hours, eventually eating away on the teeth, causing cavities. If your child needs a bottle or a sippy cup to sleep, try only with water. If that is not an option, it is highly advisable to wipe your child's teeth soon after falling asleep with a gauze or wet paper towel or Spiffy's oral wipes. Question number 2. What kind of toothpaste is best for your child? Fluoride in toothpaste is at a high concentration and is not meant to be swallowed. For as long as you are uncertain that your child is capable of spitting out the toothpaste after brushing, you should be using a safe-to-swallow, fluoride-free toothpaste, and always encourage your child to spit out the toothpaste foam at the end of brushing so as to acquire that skill. Once you are confident that your child does not swallow the toothpaste, it is advisable to use a fluoridated toothpaste. Question number 3. When should your child start to floss? Floss comes in many forms. Ultimately, floss is simply a mechanical device used to squeegee between the teeth where the toothbrush cannot reach. When teeth shift to a position tight against one another, especially in the back molars, it is highly recommended to start flossing. When the teeth are tight against one another, the bristles of the toothbrushes are too large to clean between the teeth properly, and that's where floss comes in. The technique should be simple and gentle. Pass the floss through the tight spot, hug the tooth with the floss, and rub up and down a couple of times. Do not pull back and forth in a cutting motion. You are more likely to hurt your gums that way. Number 4. Finger habits and when to stop. Habits such as thumb sucking, finger sucking, and pacifier use are very common habits acquired by most infants. And although it comforts them and gives parents some quiet, there comes a point when the habit needs to be broken. Prolonged oral habits impede proper development of the teeth and jaws. These oral habits create a force on the top front teeth pushing out and on the lower front teeth pushing in. This leads to what is called an open bite and in some instances even cross bites. Finger habits also pose as a constant source of infections. The sooner the habit is broken, the better. Consult with your pediatric dentist on when and how you should go about breaking such a habit. Number 5. So your child does not eat any sweets. That's great, but he or she unfortunately could still get cavities. Even foods and snacks that are considered healthy, such as some breads and cereals, milk and 100% fruit juices, and dried fruits like raisins and prunes, have sugars that could contribute to causing cavities. Proper toothbrushing and flossing is your best defense. Question number 6. What are sealants and are they necessary? The natural anatomy of the chewing surfaces of our molars have deep pits and fissures that are very hard to keep clean. Whenever we chew our foods, we are packing food and sugars into these grooves. Toothbrush bristles are too large to get into these grooves and clean properly, and so these grooves are a common site for cavity formation. Sealants are a composite layer bonded on top of the molars, like bonding a white nail polish, to seal these grooves and prevents foods and sugars from getting wedged in there. No one needs or must have sealants, but they are strongly recommended as a preventative measure to help prevent cavities. Also, sealants are not permanent and do need to be replaced. It is important for your child's pediatric dentist to thoroughly examine your child's sealants to make sure they are still intact. I'm Dr. Hike. I hope you enjoyed this little video. Thank you, and don't forget to brush, floss, and smile.